Namaste, I am Dr. S. Sacchidanand, former head of the Department of Dermatology and STD and Leprosy at Bangalore Medical College, who is also former Vice Chancellor, Rajiv Gandhi University of Health Sciences. Today I will be just talking briefly about steroids, that too is topical steroids. What are steroids? You must have quite often heard from your doctors that they are going to prescribe steroid for some conditions. Many times, doctor knows how long to use, when to use, and for how to taper it off. But sometimes the patients are so anxious that usage of steroid causes so many side effects. Yes, of course, usage of steroids has side effects, but it can be controlled. It's like a double-edged knife. It can be used to cut vegetables. It also can be used, if not used properly, to cut your fingers also. So that's how it is. It's a double-edged sword or knife. Steroids, what are steroids? Any chemical with a cyclopentano parahydrophenanthrene ring in it, it qualifies as steroids. And not only that, steroids are of various types. It can be used topically, it can be used parenterally, and also it can be used orally. So these drugs are given to alleviate many anti-inflammatory conditions in the skin diseases. Not that steroids are always used from exterior sources. There are internal sources of steroids. Our own adrenals produce steroids. And steroid is required for day-to-day activities and to keep us more active throughout the day, and for our regular activities also steroid is required. And usually the steroids are synthesized early in the morning and released into the blood, and by evening this level of steroids comes down, and that can be measured in many diseases also to know what the steroid levels are in the blood. Steroids are generally used for their anti-inflammatory effect, anti-proliferative effect, and also immunosuppressive effect. These three conditions help us in alleviating many diseases. Like in dermatology, we use it for any inflammatory conditions like atopic dermatitis, contact dermatitis, irritant dermatitis, and eczemas, and many other similar conditions. But what has happened really in our country is steroid abuse, especially topical steroid abuse. When these drugs are being prescribed, they are carried on for many days, used for many days, and then causes all the side effects, especially when it is used on the face. So it's called as topical steroid damage phase, topical steroid dependent phase. What exactly is this? The obsession for becoming and also looking fair is very much in Indian population. Many youngsters, they want to look fair. They don't want to have their brown skin or the black skin, and they are obsessed with white skin. So these fairness creams are very much required to be used for a long time. There are quite a few number of fairness creams available in the market, but the cheapest of them all and easily available is steroids. Many times family and friends, and sometimes even the general physician and family physicians, or even in the salons and beauty parlors, steroids are being used for facials and other conditions. And also sometimes the most abused drug is amongst the quacks. Quacks, they write steroid left, right and center because of the combinations that are available. It is said that steroid is a Ramabana. Ramabana means it is a medicine which can be used in all conditions. So very appropriate to this usage is the availability of drugs with 4 combinations, fixed drug combinations with 4 drugs, 5 or even sometimes 6 drugs. One could be an anti-inflammatory drug like steroid, one could be antibacterial, the other one is antiseptic, and sometimes even antiviral also. So these combination drugs are so freely available, and they are used as fairness creams across the country. And it has become so much rampant that many times the patients do come to us with complications. And what are the complications that we see when the topical steroids are used? As I told you earlier, it's an anti-proliferative drug. Anti-proliferative means the cell's multiplication goes down. It's brought down to a minimal level. So that the number of layers of skin, normally which is around 50 to 60 layers in epidermis, comes down to 10 to 15 layers. So skin becomes very thin. As a result of which, the underlying structures like blood vessels, they are more clearly visible. And it becomes, it's called as telangiectasia. And sometimes acneiform eruptions do appear along with that. And the prominent convexes of the face, like forehead, nose and cheeks, they become very prominently reddish, and also called as angry look on the face, or a reddish skin syndrome can happen on the face. So this, if further usage is continued, because of less production of collagen and their dermis, the skin becomes very wrinkly, very soft and supple, and also telangiectasia breakage leads to a hemorrhage into the skin called as purpuras. Not only this, skin can also develop stretch marks, not on the face of course, but elsewhere, maybe on the chest or back or low back, the stretch marks can happen. Continuous usage of steroids can also lead to hirsutism. So these are the various side effects that happen. Sometimes it becomes so severe that one cannot live without application of continued usage of steroids, topical steroids. So that being the case, at that point of time they become very anxious. They cannot get out of the steroid abuse. They come to the doctors. We doctors diagnose it very easily and recognize the condition very easily, and then try to give salvage to the patients. The first and foremost thing is to wean them off steroids, and it can't be done immediately. Steroid stoppage leads to further worsening of the condition. Sometimes they can develop periocular dermatitis, perioral dermatitis, rosacea, photosensitivity, all this can set in. So on each of these conditions have to be taken care of, and the patient has to be weaned off very gradually. Maybe we may use some moisturizers, we may use topical non-steroidal drugs, anti-inflammatory oral drugs, antibiotics. These can help a lot in controlling the condition. Once the condition is controlled, then we can put the patients on long-term damage control topical drugs, so that the patient comes back to normalcy. So this is a very tedious process. It may take few weeks, it may take few months, but the patient has to be very patient, and doctor also has to have a lot of patience in treating such patients. But what is more important is the awareness that we need to create. The Indian Association of Dermatologists, Venereologists and Leprologists had taken this up in a very big manner, because it was so rampant in the society that throughout the country we had a big campaign against usage of topical steroids and sale of these steroids over the counter. That has to be done. Because of our intense and perseverant manner in which we did this campaign, the Government of India took cognizance of the fact that steroids are being misused, and they converted this into Schedule H drug, wherein it cannot be prescribed, it cannot be dispensed without prescription from a doctor. So pharmacists have to be aware that they cannot just sell the drug over the counter. This is the first thing that can be done. Second thing is to educate all the non-doctors who are prescribing or writing steroids, which they are not supposed to, and tell them that they should not prescribe these drugs or use these steroids in any combination over the face. And third is educating general public. We need to educate the general public as to how they have to go and consult a qualified dermatologist for any steroid prescription, which the doctor knows how to use it, how long to use it, and how the benefit of steroid can be reaped with optimum usage. So this is what is the campaign that IADVL very successfully carried out, and today I think we have brought down the menace of topical steroid damage to a great extent. But however, it still keeps happening here and there, and we need to be aware of the situation and then try to avoid this. It does a lot of help and benefit to the patients if proper treatment is instituted to them. I support this campaign against topical steroids. Thank you so much.